So, Dr. Varghese, again, welcome to this podcast. It's a real privilege and a pleasure to have you join me for this conversation today. What I think is maybe we'll start with you providing us a brief overview of your recent work and experiences in the area of mental health.
Yeah, so I'm right now a senior professor of psychiatry. I spent about 40 years training and working at the National Institute of Mental Health and Neurosciences, that is NIMHANS, here in Bangalore. The main work that I've done over the years is basically to do clinical work, training postgraduates, doing research, and also various administrative aspects in mental health. So in some ways, things are evolving and things have changed. And in some ways it is not. And I guess in the way it has not changed is possibly in the way that people are still not aware. People are not aware that, of what mental diseases are and what happens, how do you pick it up. So knowledge is pretty poor, not just among the public itself, but also among family members and also among many physicians. And that's the sad part. But in terms of changes that I've seen in the last 40 years is that the services that are provided for mental disorders is, I think, slowly improving. And the government programs, the government policies, legislation is all changing in the last 10 years or so. So that is a very remarkable change that I can see that, and we can talk more about it later. India came out with a national health policy, and very recently there's been drafted a national mental health policy too. So that is a policy from the policy part. So for everything, when delivery of health services is talked of, we have to think about a policy, a legislation, and also a program. Okay. So legislation is something that we've had in the country in the last few years, and very recently the the Mental Health Care Act 2017 is a very, landmark act that has come out a few years ago, which actually is a right-based act, which talks about how everybody in the country has a right to get and access mental health care. Okay, so here I must take you one step back and tell you about what the WHO has talked about a few years ago of the pyramid of care. Okay. Now, at the top of the pyramid, and that's the narrow part, you see, the top of the pyramid is the narrow part. And that is something where you have psychiatrists, mental hospitals, and all those things. It can be for any healthcare, it can be for a cardiologist, it can be for a gastroenterologist. The top of the pyramid is cost intensive. You need equipment, you need personnel, you need mental hospitals, or you need general hospitals, or you need cardiac centers or whatnot. At the bottom of the pyramid is the broad part which everybody can access, and that is self-care, right? And informal care. Now, informal care and self-care is not cost intensive, and it's simple, and it's stuff that you can do yourself. So apps and those kind of automated maybe websites, devices, or apps, whatever you have, is very useful for self-care. There are 3-4 things that I can mention. That number one is community health care. So using basic health workers, maybe counselors, maybe physicians, and this is really low cost. You're not looking at specialists. Using them to deliver healthcare services and combined with the NCD program. Because, you can't look at mental illness in isolation. Mental illness is very much, as I said, intertwined with the other diseases. So you must have actually a systemic unitary model where somebody looks at the general health and well-being of a person. The second aspect is the issue of how we are now training personnel, all over the country using tele-education programs.